Arthritis. Arthritis is a word that I think invokes fear into a lot of people. And most people will come into the clinic telling us that they're in pain because they're old and because they have arthritis. But actually, arthritis is a completely normal process that begins even from the age of 20 years old. Because as you lay force down through a bone repetitively and repetitively, bone is living tissue and it will lay down more bone to try and keep your stability within that joint. The problem is that over time, sometimes that bone can increase in size too much, and most of the time it's the itis part of arthritis that is the problem, and itis refers to inflammation. You can have an extremely arthritic joint that is not painful in the slightest. Just like you could have an MRI scan or an X-ray of an arthritic knee and could show as arthritic, but yet you feel nothing. Or could be the other way around, that you have a scan on the knee, it shows up as perfect, yet you're in debilitating pain. So we really need to take this idea of arthritis almost with a little bit of pinch of salt. Because if it's extreme, there's no doubt that it's going to be painful. But what's more important is stopping our joints from degenerating the cartilage so far that that becomes a problem. Because ultimately, the process of arthritis is the wearing away of the lining, the cartilage of our joints over time. Only when it becomes extremely severe, so that there is nothing left, do we then create pain, as the nerve endings in the bone tissue are able to transmit information to the brain and give us pain. Until that happens, it's actually very unlikely that any pain is going to happen. So probably around 70% of patients that come in telling us they have arthritis can be helped. It's only in extremely severe cases where the process has gone too far that they require any kind of surgery. So how can you stop yourself from getting too far? Well, really, it's about stability around a joint. If I have a joint that has muscles on either side, in order to create an equal balance of forces, I need to make sure that I can utilize both muscles switching on, switching off, switching on, switching off, equally as I walk and move over time. But if I have a right knee problem that's working really, really hard to compensate because actually I've injured my left ankle in the past, and as we've talked about before, our weight bearing has shifted, then eventually this balance of the muscles on one side to the other is going to be out of sync. And so we're going to increase potential wear on one side of the joint over time. If the brain isn't allowing this equal measure of muscle forces on either side, this is really the key. And so what we try to do to prevent the arthritis from getting more severe is make sure that you've got an equal muscular activation on each side of the joint.